Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine. Today, Good Morning Washington's Health Spotlight is on regenerative medicine and how revolutionary treatments are helping patients to get out of pain without surgery. I'm joined now by Dr. John Farrell with Regenerative Orthopedics Sports Medicine and his patient Sarah. Wonderful to have both of you here on Good Morning Washington.
Well, kid, thanks for having us.
Yeah, always love telling these stories and sharing these stories because it's so important. It helps so many people that are watching right now. So let's start by talking about regenerative medicine when it comes to, rotator cuff tears.
Yeah, well, absolutely. So when we look at regenerative medicine in terms of rotator cuff tears, it's really been a game changer. So when we look at surgeries that actually use PRP or bone marrow in concert with the repairs, we find that the re-tear rate of after those surgeries significantly decreases. But we're also finding that a lot of times we can actually avoid surgery by using regenerative medicine and getting these tears at a smaller size before they actually need surgery.
And Sarah, you were able to avoid surgery by seeing Dr. Farrell. Tell us a little bit about your journey and how you found Dr. Farrell.
I had a partial rotator cuff tear for 20 years. And all of a sudden I was having shoulder pain, and someone recommended Dr. Farrell and ROSM to me. And I went to see him, and he did his ultrasound and said, "You have a full rotator cuff tear." And I was shocked. I didn't know I had that. And he said, "We have two choices. You can either have surgery, and the recovery would be about 6 months, or we can do this procedure, and your recovery would be about 3 months, and you'll be doing exercises and physical therapy in about a month."
And that was back in 2019 that this all took place, and here we are in 2024, and how do you feel?
Oh, I'm great. I can bench press 40 pounds in the gym. I can do overhead press with 20 pounds. I'm fully functional.
Well, that is incredible. And we talk about getting out of pain without surgery. So now talk about the process that Sarah went through.
Yes, so we did something called microfragmented adipose. In layman's terms, we took fat out of her love handles, out of her hips, and we injected it directly into the tear. And the reason why we use fat is because fat contains mesenchymal stem cells. And so these stem cells, they serve as a signal to tell other stem cells in the body to come, to heal, and to repair.
We talk a lot about just educating people about regenerative medicine. Why is it such a better option than maybe the traditional way?
Well, I think what it does is it gives people other options, right? Historically, if you come in with a partial thickness rotator cuff tear, your treatment options usually would involve cortisone, and we know from research that cortisone will actually weaken that tendon and actually go from a partial thickness tear to a full thickness tear. And then if you have to get a full thickness tear repaired, you're usually in a sling for a month, and then after that being in a sling for a month, you end up with a frozen shoulder where you can't move it normally. So you have to do physical therapy for months and months to get that to range of motion back, and it's usually about 6 months before people are back to normal. So this gives them an option that's minimally invasive. It avoids the surgery, anesthesia, and it's a lot less painful for them to get back to being functional.
Sarah, there are people watching right now that may have already seen the surgeon, have a surgery scheduled. What's your advice to them after going through the treatment with Dr. Farrell and ROSM? What would your advice be to them?
My advice would be go see Dr. Farrell because he's like a magician. Go to ROSM, let them give you another opinion.
Yeah. And that's where it all starts, just that conversation and starting and hearing your other options. Sometimes people don't realize there are other options.
That's the whole thing, yeah. When they can kind of come in, we take most major insurances, so they can have an evaluation, get a musculoskeletal ultrasound, and we can talk about all the different options that are on the table.
Can you tell us about the case study that was published when it comes to regenerative medicine and why that's so important?
Yeah, so we actually took her case and we wrote that up because this was the first time that, to our knowledge, that a full thickness rotator cuff tear was treated with the microfragmented adipose, or the fat, and actually showed evidence of healing on MRI. So we had an MRI before her injury, before we treated it, and an MRI approximately 9 months after treatment, and it showed evidence of healing read by the same radiologist.
Unbelievable results. Another unbelievable headline in 2016, Washington Post wrote an article about you. The headline was, "Why I Will Never Have Shoulder Surgery Again."
Yeah. Well, that was a patient of mine who happened to be a Washington Post reporter, and she just told her story, which really kind of mimics most people's story dealing with rotator cuff tears. She went through cortisone, it got worse, and we got relief for about a month or two, then it got worse again. Then when it saw the surgeon, she had an operation done by one of the best orthopedic surgeons in the DC area. He did an amazing job with the surgery, but she was in pain, she was in a sling for a month, she got a frozen shoulder, it took her 6 months to get her life back. So the second time she got a rotator cuff tear, she came to me and she said, I don't know if I believe in this PRP stuff, but I'll try it. And so we did 2 PRP injections, 6 weeks apart. She didn't have to spend a month in a sling, she didn't have as much pain, and she got completely back to normal. And we were able to see healing on musculoskeletal ultrasound. And so she wrote this article just explaining her story.
Absolutely incredible. Sarah, thank you for sharing your story.
Thank you.
And now is the time for you to reach out to ROSM. If you've been in pain and you're looking for other options, make that phone call. All the information is up on your screen right now. ROSM works with all major insurance carriers, and they can help you get out of pain without surgery as well. Thank you both for being here today.
Thank you for having us.
Thank you.